Good morning, guys. On my way to the gym. We are getting the hang of this discipline thing. We're getting the hang of this body goal thing. So let me tell you what happened yesterday. You see, being in the right place at the right time with the right people, right? It really opens up to a lot of things. So yesterday when I was obviously at work, let me just tell you, in my field of work, there's a lot of opportunities one can grab. My mother's right because it's cold. There's a lot of opportunities one can grab, a lot. And it's not just focused, it's not just a one-way road. Like from nurse, you're gonna be a doctor. No, there's a lot of things you can become. You can be a representative for the medical equipment. You can be a radiographer. You can be an aesthetic nurse. You can be you can be a phlebotomist. You know, all those things. You can be a perfusionist. All those things, right? So cool. The next step to what I'm doing now is supposed to be being a scrub tech, right? Of which, when I working with my scrub technicians, they're always tired, they're always on their feet, they always complaining about fatigue, right? And I've always been afraid of that. I'm afraid of, not afraid as such, but then I'm just like, if I were to be a scrub tech, am I willing to stand 7 hours? Am I willing to be on my feet for the next 10 hours, right? Cool, that's the vision I had. And I was just like, you know what? I'm comfortable being an aesthetic nurse. I'm comfortable where I am. Because I already like how the mechanism of medication works in a human's body. Okay, I'm mastering that. How all the different medications work for different cases. I'm mastering that. Okay, cool. Right? I'm comfortable. But then, the inner me does not like comfortability. I like to be challenged. I like to figure out new things. I love to solve a problem. Right? Cool. That problem better be solvable. Okay? Yeah, well, that's me. I love interesting things, figuring out new interesting things, right? Cool. So I happened to speak to this person, this lady, nice, middle-aged, wouldn't say she's old lady. She's been a scrub tech for 20 years, but now she's a sales rep at a hospital. This lady says to me, you know what's nice? I've been a scrub tech for like 20 years, and what she loved about it was that nothing was ever the same. It was constant. It was constantly changing. Like the things she had to pack, the equipment she had to organize were constantly different for every case. So we're talking laparoscopic cases. Everything was just different. We're talking orthopedic cases. What can I say? Craniotomy cases, abscess. Every set was different, and that was interesting for her because she had to figure out, I only know basic equipment now. I only know your McGill forceps and your scissors and stuff like that. But there was more to that every single day. And then she was like, it is interesting how you will be able to see things, especially the sutures as well. You're able to see many cases, and you can make suggestions to the doctor. I'm like, no, doc, why are we using this type of suture? Why are we using this Vicryl for this patient instead of using maybe a monocryl, or a Novofill, And she was saying that, seeing how you are, like, she was not describing me like you're full of potential, you love, you're very inquisitive. That would be a great field for you. And regardless of the money, yeah, there is money, sure, but then imagine how much you could learn. You get it? And it wants you to be like hyper focused on a certain thing. Like you have to be so focused because you are in charge of that certain unit. And then I was like, oh wait, that's my weakness, because once I start to be, I was like, that's my weakness because I'm a person that gets hyper focused on one thing, and having to be in charge of a full unit, how will I manage that? You get it? because there's a floor nurse who requires my command, and then there's the anesthetic nurse that I have to make sure is in line, and then, you know, rapper, I'm speaking to the doc and stuff. So she's like, no, you have that, of course, but then over time you will learn. Over time you will learn. And I feel like you would be the best fit for that place. And then I'm just like, okay, yeah, I hear what you're saying. Like, you're changing my perspective. How do I get in there? How do I show the necessary people that I can do that? She's like, be present and be persistent. Just avail yourself in those environments, right? Just be asking like, okay, sister, what set can I get for you for this case? No, what is the next thing, right? If they were to ask, maybe we're draining an abscess that day, right? And the patient was already on antibiotics, right? And then she's like, the sister asked, can we have a pass swap, right? And the doctor was like, no, the patient is already on antibiotics and stuff. And then the sister was like, but doc, we need a pass swap to make sure that the antibiotics are working. And the doctor was like, oh yes, cool. So it's those things. Know what is next, know the next step, and then doctors will the sisters and the people in that blue area, in that sterile area, will see you, and they will want you, and they will recommend you. I'm like, okay, cool. Am I willing to work hard enough? Honestly, I know I can work hard, guys. Like, I know my potential, but I'm afraid of myself. Really, nothing scares me than myself. The things I can do when I lock in are scary. I swear my mouth is dry because, guys, it's cold. The things I can do when I lock in are scary. I see with